Thanks for joining us on this Saturday afternoon at our new time, noon. This is Your Health Matters. I'm your host, Scott Duncan, and we're here every Saturday to discuss your physical, mental, and spiritual wellness. My guest in studio is Dr. Fakih from Florida Pulmonary Consultants and Sleep Disorder Center, and also Florida Pulmonary Research Center. And we were talking a little bit about lung cancer because the statistic I heard, and you think it's probably lower because there have been some advances, is that if a doctor, and usually it's your pulmonologist, sits across from you, and this is according to the folks at the Lung Association, 87% of those people are going to be dead within a year. You think it's getting better because there's some new stuff coming out?
Yeah, I think it's getting better, especially because the key in the success of treatment of lung cancer is early detection.
Right.
Is to try to find them earlier. Before, I think we used to find a lot of those cancers were already spread at stage 3 or 4,
Right.
where really you couldn't do that much about it.
Somebody would come in and they'd be coughing blood or have a really bad cough, and you'd take a chest x-ray and there's a mass.
Yeah, or that mass was already involving certain areas of the lung that you couldn't operate, or you couldn't do surgery, or had it spread into the lymph nodes, or had it pressed into the bone. So, but right now with the with the CAT scans of the chest, we are able to pick up lung cancers earlier, I think, and that has made a change. The other thing that I have been, before, when somebody had lung cancer that was stage 3 or 4, or small cell lung cancer, I used to see these people, and I could tell this person would be dead in 3 to 6 months, regardless of.
Right.
Right now is amazing. I have people like that comes to the office a year, 2 years, and it's still. So there has been a lot of advancements.
Sure, and as I mentioned, we do clinical research at the facility, and there's actually some lung cancer. There's 3 technically. 2 of the trials are not about a treatment directly for the lung cancer.
Yeah, we're actually going to do a very nice study that is a newer medication to try to prevent the weight loss and the muscle wasting associated with lung cancer.
Caused by the chemotherapy?
Well, caused by the cancer in itself, and by the chemotherapy, and all of the other conditions associated with the lung cancer. So what you do with this is, the study is to try to prove that if you try to prevent this from the beginning, the weight loss, the muscle wasting of the patient, that these patients are going to do better and are going to survive the cancer better.
Because if they got more reserves and better general health.
Better general health. So it's not really a treatment directed against the lung cancer in itself, but is really to try to build up the person in order to be able to fight better the lung cancer.
Okay, but with that trial, you do have to get someone right as they're diagnosed before they start chemotherapy.
Absolutely.
Okay.
Yeah. The people have to be started, and the study takes about a week to 10 days to complete. So it's really within the time that they get diagnosed, that they get referred to the oncologist to start the chemotherapy. So there is not going to be time lost or anything like that.
Okay, and the other one though, that the other trial is actually for a treatment for lung cancer.
Yeah, the other trial, we still are talking about that one. That is a new medication for it, and that is directed to the lung cancer.
So there are new treatments coming along.
There are always new treatment. Actually, there are, as of today, there is more than 5,000 different clinical trials in lung cancer.
Wow. And so a lot of the drug companies out there are committed to finding new treatments.
Absolutely.
Yeah. Folks, if you've got a question about your lung health, you're more than welcome to join us. The numbers to join us are 407-916-5400 and 866-916-5400. My guest in studio today is Dr. Fakih from Florida Pulmonary Consultants and Sleep Disorder Center. We also do sleep studies.
Right.
which is becoming more and more part of a lot of sort of aspects of your health, your weight, your blood pressure, diabetes, all kinds of things relate to whether or not you're sleeping right.
That is correct. It is amazing that when I started practicing medicine, sleep was felt to be something automatic. There was nobody had any problem sleeping.
Right.
Now everybody had problems sleeping.
So yeah, the worst case, oh, doc, I can't sleep. Here's a pill. Go on. Right.
No, and the problem is sometimes doctors are reluctant to give people sleeping aids because there is certain, addiction to it, and they don't want to, encourage that. But sleeping is extremely important, and it's not only insomnia that is the problem. I think sleep apnea has much more problems.
That's the one where you actually stop breathing while you're sleeping, right?
You actually, there is actually, I've seen cases of a person who is still breathing more than 100 times every hour when they sleep. And the brain wakes up, gets interrupted about 80, 90, 100 times every hour. It's like more than once a minute.
And so you don't get it, you think you're sleeping, but you're not really getting good sleep.
You're not. So you're tired during the day, you have no energy, you wake up tired, you sit in a place watching something and immediately you fall asleep. You are not able to finish a movie.
Yeah.
You are not able, just because, and what happened is when you are sleeping during the day and this thing is happening, the same thing is happening. You are stopping breathing, your brain keeps waking up. So this is people that sometimes don't get a good night's sleep in 15, 20 years of their life. It is really bad.
And I've talked to a lot of people who have sleep apnea and then start getting the treatments, the machine that blows air into your nose and stuff, and are religious about it. I mean, doctors, lawyers, Indian chiefs across the board. Once somebody gets on one of those machines, uses it right, and sticks with it, they're fanatical about it.
Yeah, some people are. We have to say there is another group of persons who have problems with the mask, and the problem now is that there is no good follow-up. What we find in my practice is that a lot of these individuals don't have really good follow-up with the problems that they're having with the mask. So they get a mask, and they just give it to them, say, hey, use
good luck with that, go have fun.
Good luck with that, and that is a problem.
And that's one of the keys to the way you do things in the sleep clinic. And of course, our sleep lab director, Felix Monteagudo,
right.
It's about the process after you're diagnosed as much as it is the diagnosis.
Yeah, we are passionate about people getting, trying to really help people accommodate to these masks because they are so important though.
Yeah, well, I mean, it's just like your lung cancer patients. It'd be like if you had somebody with lung cancer and they weren't taking the chemotherapy and you didn't do anything to make sure they were treating that disease. It's kind of the same thing. If you've got a disease, treat it and take care of the problem, right?
That is correct. And but sleep apnea really has become one of the most frequent illnesses. I would say. Probably I would say after high blood pressure, diabetes is probably right up there.
Wow, really, that kind of rate?
It's figured like about 9 to 10% of the American population
has sleep apnea of varying degrees.
Varying degrees.
Okay. Well, we're just about getting ready to head into a break. Now, the other side of the practice is the Florida Premier Research Institute. Currently, several trials going on. If you have COPD, if you have asthma, if you have gout, bronchiectasis, which is cystic fibrosis in adults, right? Sort of?
Sort of.
Okay. If you have myelofibrosis, which is a blood disorder, polycythemia vera, and we've got, of course, got the lung cancer trials. If you're interested in any of those, you can go to orlandoresearchclinic.com. and you can get more information, submit your contact information, pick from a list of the conditions you may be interested in. You can also, if you've got questions about your lung health, go to our other website, orlandolungdoctor.com, and there's also answers to questions about sleep medicine there. When we come back, let's talk about asthma, because that's something that you can have whether you're smoking or not smoking, or there's a whole lot of different aspects to that disease as well.
That is correct.
When we come back, you're also welcome to join us at 407-916-5400 or 866-916-5400. You're listening to Your Health Matters on 540 WFLA.
You told me that